Imagine breaking your leg 40,000 years ago. No hospital, no morphine, no anesthesia. Just you, a group of people who love you, and whatever the earth happens to be growing nearby. And here's the part that should genuinely unsettle you. They probably handled it better than you'd expect. Not perfectly, not painlessly, but with a level of sophistication that most people assume simply didn't exist before modern medicine. Today we're going deep into one of the most overlooked survival stories in human history. How our ancestors managed agony without a single pill, and what that reveals about the human body, the human brain, and the plants that were quietly working alongside us the entire time. Let's start with the most obvious question. Did ancient humans actually have pain relief, or did they just suffer? The honest answer is more interesting than either extreme. They had an entire pharmacy. It just wasn't in a bottle. It was growing in the ground. Willow bark is the best place to begin because it's the ancestor of the most common painkiller on Earth. Ancient Sumerian texts from around 4,000 years ago already described chewing willow bark for pain and fever. The Egyptians documented it too, in medical papyri that read almost like modern prescriptions. And here's the twist that should make your brain itch a little. Willow bark contains a compound called salicin. Your body converts salicin into salicylic acid, and salicylic acid is the direct chemical ancestor of aspirin. The exact same molecular pathway that ends in a Bayer bottle on your bathroom shelf starts with someone, thousands of years ago, chewing on a piece of tree bark and noticing their headache got quieter. That's not folklore. That's functional pharmacology, discovered through trial, observation, and the slow accumulation of knowledge passed down through generations. Now let's talk about something stronger. Opium. The opium poppy was being cultivated by at least 5000 BC, and by the time of the ancient Sumerians, it had a name that translates roughly to joy plant. Not subtle. The Egyptians used it for pain and to quiet crying infants, which, uncomfortable as that sounds today, tells you they understood exactly what it was doing to the nervous system. The active compounds in opium bind to the same opioid receptors that modern painkillers target. Ancient healers didn't know the word receptor, but they knew the effect, and they knew the dose that helped versus the dose that killed. That knowledge was earned the hard way, through generations of careful, often fatal experimentation. Here's where it gets even stranger. Ancient humans weren't just managing pain chemically. They were managing it socially and psychologically, and modern neuroscience has actually confirmed this worked. When a shaman performed a ritual over an injured person, chanting, touching, creating ceremony around the healing process, that wasn't just theater. Expectation and belief genuinely alter how much pain the brain registers. This is the placebo effect, and it's not imaginary. Brain imaging shows that when someone believes they're being helped, their brain releases its own natural opioids, actual endorphins, actual pain relief manufactured internally. Ancient healing rituals, without knowing the mechanism, were activating a real neurological pathway. The chanting worked. The ceremony worked. Not because of magic, but because belief is a lever the human nervous system will actually pull. Let's talk about something almost nobody expects on this list. Maggots. Yes, maggots. Maggot therapy, deliberately introducing fly larvae into a wound, sounds like the opposite of medicine. It's actually one of the more brilliant tricks in the ancient toolkit. Maggots eat dead, infected tissue and leave healthy tissue alone. They clean a wound more precisely than most modern tools can. This wasn't a desperate last resort. It was documented, intentional practice across multiple ancient cultures, and it's still used in specialized modern medicine today for exactly the same reason. Sometimes the grossest solution is also the smartest one. Now for the part that sounds like it belongs in a horror movie, but is entirely real. Trepanation. This is the practice of drilling or scraping a hole directly into a living human skull, and it is one of the oldest surgical procedures ever discovered. Skulls with healed trepanation holes, meaning the person survived, sometimes for years afterward, have been found on nearly every continent, dating back over 7,000 years. Some skulls show multiple healed holes from multiple separate procedures on the same person. Think about what that means. Someone endured this surgery, survived it, and came back for more. Historians believe it was used to relieve pressure from head injuries, treat seizures, or address conditions we'd now associate with severe headaches or psychiatric symptoms. And crucially, Some form of pain management had to be involved, because the survival rates were far too high for this to have been performed on a fully conscious, unmedicated patient without some method of dulling the experience. We don't know exactly what they used in every case, but we know they used something, because otherwise the body's own shock response alone would have killed far more patients than the record actually shows. There's also a simpler layer to all of this that's easy to overlook: alcohol. Fermented drinks go back at least 9,000 years, and their numbing effect on pain and anxiety would have been obvious almost immediately to anyone who tried it. Combine alcohol with herbal sedatives, and ancient healers had something functionally similar to a crude anesthetic cocktail, used before surgeries, bone settings, and childbirth. And that brings us to something that deserves far more credit than it gets: the human body itself. Endorphins, the body's built-in painkillers, spike naturally during extreme physical stress, injury, and even during intense group rituals like sustained dancing, drumming, or chanting. Ancient communities that engaged in these long, physically demanding communal rituals weren't just bonding socially. They were chemically flooding their own nervous systems with natural opioids. The body was doing pharmacy work on its own, no plant required. So when you put this all together, a very different picture emerges. Ancient pain management wasn't primitive people gritting their teeth and hoping for the best. It was willow bark for headaches, opium for severe trauma, alcohol and sedative herbs before surgery, ritual and belief activating the brain's own opioid system, maggots performing precision wound care, and in the most extreme cases, surviving skull surgery with some form of pain control sophisticated enough that people came back for a second procedure. None of this was written in a textbook. It was learned the hardest way possible, through direct, often fatal trial and error, and then passed down mouth to ear, generation after generation, until it became knowledge so reliable it eventually evolved into the medicine you use today. That aspirin in your cabinet, that local anesthetic at the dentist, even the psychological comfort of a doctor's reassuring voice before a procedure. All of it has roots that go back thousands of years, to someone chewing bark by a fire, quietly discovering that pain could be managed. They didn't have your tools, but they had time, observation, desperation, and each other. And somehow, that turned out to be enough.